Food Basket has been through quite the few years. We had the Kilauea lava flow, we had Hurricane Lane, we had the partial shutdown of the US government. All of those things impacted us hugely, and we saw a lot of people that had never needed to rely on the services at the Food Basket before. And in the midst of all of that, two of our dearest staff members, Joanne Abilene and Bernard, Uncle B as we called him, Torres, they died from heart conditions. They're both native Hawaiian. They died way too young, and we miss them so dearly. And I've wondered whether if we'd intervened earlier and gotten everybody together to look into eating better. We're really promoting fresh foods, but what about us? What about our staff? What about our families? And so we examined how we could do that, and this is what we worked out with HIʻA and our board was, let's try this. Let's see if we can change the way we're eating and take a good look at educating everyone about what local fresh food could do for us and our community. So that's how we started.
Okay, so with our pilot project with the Food Basket staff and some family members, we started off with a 10-day jumpstart program providing plant-based meals, lunch and dinners for everyone for 10 days. And it was a good exposure for all of us to try something new, try different recipes, try different foods, and people did see results.
So I went on that plant-based program and I was really happy because at least they train you how to eat healthy, how to use the vegetables that we have, because Hawaii have a lot of beautiful vegetables and produce, and it's all around us, but we just need to know how to incorporate that food into our daily meal. Because when you eat healthy, you feel healthy and you feel good about yourself. So I kept on the plant food program and it did wonders for me. So I changed my eating habits and I seen my weight being dropped in little by little. I started 6 months ago and I already lost about almost over 30 pounds.
Let me tell you the benefits of that happened to myself and my husband. I was able to sleep better. I used to have, achy muscles and joints, and that, it got rid of that, and I had so much energy. And then all the other biometrics, it improved.
I think through our pilot study, what I learned, of course, I hope that everybody would find some health benefits, right? And that we could prove that with our biometrics and the microbiome testing. But what I didn't expect was what a cool team builder this was. It's a funny thing, but it's so exciting to be in a workplace where we're all talking about food and we're comparing notes and recipes, and it's building community in a totally different way than I had ever anticipated. And people have had healthy outcomes as well.
So we were very excited to partner with HIʻA, knowing that they were coming from the research background and their experience on Oahu and elsewhere. And they were so welcoming and invited our questions. They worked with us on our surveys for our participants, talked us through what kind of biometric information we were collecting from our participants and what would be helpful as we, I think, try to grow and expand a little bit more, looking at the health and wellness of Hawai'i Island. We're not just providing food for people who are hungry. We also want people to be healthy and thrive. And the research that HIʻA is helping us develop, I think, will help us, move forward and expand and become I think, greater organization.
I think at the end of this study, what I've learned is, number one, how important it is that people understand the power they have to choose their health outcomes, that they can help themselves with good food, and that whole concept of food as medicine. And then also the idea that we can impact the greater community through this work and through this study, and that HIʻA helped us do that. We're trying to build resilience into our community, we're trying to build good health outcomes, and we're trying to build food security, looking upstream at helping our farmers produce more so that if the barges quit coming, and there's a high probability of that given all of our disasters that we've been dealing with, that we can eat well here on this island no matter what.